Technological advances have allowed clinicians and surgeons to biopsy difficult-to-reach locations with greater ease and less morbidity. Unfortunately, these advances and techniques create many biopsies which are extremely small and fragmented. Histological methods have changed very little in the past 100 years. When these smaller biopsy fragments and flecks are embedded into the paraffin, it makes it very difficult to know where these minute pieces are within the block and when to quit trimming and when to begin collecting the material. This causes the histotechnologist to guess where the biopsy is within the block and how deep to trim. This guessing game causes some specimen blocks to be cut too shallow and others to be cut too deep through the specimen. This process is time-consuming for the histotechnologist, frustrating for the pathologist, and can be expensive and time-consuming for the surgeon and patient if a diagnosis cannot be made and another biopsy has to be performed. Well, there is a new way to embed and process these smaller, difficult biopsy specimens. Introducing the Biopsy Assistant Color-Coded Wax Embedding System. No more guessing how deep to trim the block and start collecting the biopsy ribbon. The small biopsy fragments are embedded between different colored waxes, which indicates to the histotechnologist when they have trimmed to the depth of the embedded specimen and need to start collecting the wax ribbon. The process is easy and simple to use. At the embedding station, the base layer with a reattached middle layer is placed in the wax mold. The middle layer has a central well in which the small biopsy fragments are placed. Once the fragments are inside the well, liquid paraffin is added to fill the remaining void. With the well completely full, to eliminate any air bubbles, the top plate is then placed and liquid paraffin is then added to fill the mold while holding the top plate in place. Once filled, the mold is placed on the cooling side and allowed to harden. When the tissue blocks have cooled and sufficiently hardened, they may be placed in the microtome and cut as normally done. When using the biopsy helper, the histotechnologist can trim away the base plate without worrying they might be cutting into the tissue. Once the base plate has been trimmed away, the wax color changes, indicating to the technologist to pay close attention and to begin collecting a ribbon of the biopsy material. Additional ribbons and deeper sections can be cut until the wax changes color once again, indicating the tissue has been cut through. The colored wax biopsy assistant system saves time, money, and frustration among pathologists, clinicians, and patients. By maximizing tissue retention for diagnosis, the color wax system has fewer inadequate biopsy reports and reduces the need for pre-biopsying the patient.